pandemic has been very hard mentally on many women. We've heard from mothers who have felt overwhelmed, and we've seen evidence of how the job market and childcare have been impacted. Joining us now is Dr. Angela Drake. She's a psychiatrist with UC Davis Health. Thank you so much for joining us, and talk about just what you have seen firsthand in terms of the impact of this last year on people's mental health.
Well, I think that you see a lot of changes in people. People who initially were resilient and really kind of rallied to get through the stress as it continued on for months and then into 2 years. People have really hit a wall, and they're really suffering more, and we're seeing a lot more people looking for treatment at this point.
So, you know, as you point out, the first year we were just kind of like, okay, we're going to get through this. Then into a second year, the impact was different. What advice do you have for people who have felt overwhelmed or maybe isolated?
Well, I think that the pandemic has made a perfect storm. Right? It's not just that we're under considerable long-term stress, it's also that we're disconnected and isolated from our social support networks. So one of the things that I really emphasize with folks is to self-monitor. Right? Because you may be not seeing friends as often or family, it's really important to kind of be in touch with your own emotions, how you're doing. Are you noticing problems with irritability? You're not sleeping as well. You're losing your temper. Because again, the best thing that I really recommend for people is to reach out and get connected with someone if they are noticing changes.
So let's talk about therapy, because, you know, women often just, we are last in line for self-care, and finding the time to drive to an appointment and, you know, wait and all of that can be a barrier. You are now doing more of these appointments over Zoom and telehealth. How is that working?
Well, we really rapidly went to telehealth appointments at UC Davis as soon as we closed for the pandemic. And so we've had a considerable experience with it now, almost 2 years. And I have to say that it's worked really well. It's worked well for our clients, because they don't have to park, they don't have to drive on the freeway, they don't have to do all the things that we often have to do to get to an appointment. They can just set up their computer in their living room, and I've even had patients who've done sessions from their phone in their car, and they leave work and go out to the car for a half an hour, 45 minutes, so they can work it into their day in a really seamless way. And in some ways, I think it's very comforting, because you know that the person is there, but they're not right there. So it gives people a little distance, right? It's kind of scary to go into a therapist's office.
It's true, and you've got the flexibility, and you can get the help that you need. Dr. Drake, thank you so much.
You're welcome.
Always.
Thank
we appreciate you.